Hi, this is your Central New Jersey chiropractor, Dr. Perry Wolk-Weiss at the Get Well Center located in beautiful Bound Brook, New Jersey. And what I wanted to make this video today to talk about three solutions that would help people with chronic lower back and neck pain that your doctor probably never thought of. These are three things that I rarely find most physicians and even some chiropractors rarely think of in trying to help people with lower back pain. Now, I see a lot of patients with different kinds of back problems, whether it be neck pain, lower back pain, shoulder problems and knee problems, a lot of different musculoskeletal problems. And certainly my first goal is to get you out of pain as quickly as possible, get you on with living your life. So I provide short-term care with effective results in the shortest period of time. But what I want to talk to you about are three things that most people never look at when considering chronic lower back pain. I'm talking about the lower back pain, you know what it is, when you get up in the morning and you wake up and you're all stiff and bent over and it feels sore, and as you get moving you feel a little bit better, and this goes on and on and on like that. And certainly it's not taking more ibuprofen or Aleve or any other medication like that. These are three key things that I find on my patients over the years that can really make a big difference in the quality of their life and getting rid of their lower back pain. So the first thing I want to share with you is, number one, is magnesium. Magnesium. Magnesium is a mineral that's responsible for over 700 different enzymatic processes in the body. Everybody talks about calcium. They want to take calcium for their bones, but they forget about magnesium. And you need a balance of magnesium to calcium in order to allow your muscles to work. Calcium's job allows your muscles to contract. Magnesium allows your muscles to relax. So if you're deficient in magnesium, and I see a lot of deficiencies in magnesium because of the diet that most people consume nowadays, you don't have enough of that magnesium in order to allow the body to really relax the muscles. And as a result, they stay tense all the time. When they stay tense, you have that stiffness, that uncomfortableness, that pain. Plus, magnesium helps to manage inflammation in the body. And the body needs to keep the inflammation down, because when you have inflammation, you have pain. So certainly magnesium is important in that. Also, deficiencies in magnesium can make the muscles irritable. They can give them tics and spasms, and that's never fun. So we check patients for magnesium deficiency. It's a simple blood test that can be done, but you got to pick the right blood test, not just any magnesium test, but you have to have the right kind of blood test to check to see if a person's deficient in magnesium. And it's important to make sure you know which magnesium to take. There's lots of different forms of magnesium out there. There's magnesium oxide and glycinate and threonate and a whole bunch of different types of magnesium. Do you need liquid or pills? These are things that I have expertise in that I help my patients figure out to make sure they're on the right magnesium for their body if they need it. That's the key. Don't just go run out and buy magnesium because I said it. You need to make sure that you need it. And if you need it, it can be very helpful in alleviating back pain. Number two on the list is vitamin D3. Vitamin D3. If I took 100 people and had blood tests run on them and looked at their serum D3 levels, I would not be surprised if almost 90% of them were deficient in D. I had a patient once who was coming in complaining of shoulder pain, and we were working on his shoulder and it was feeling better, but he was also mentioning he's got pain in other joints of his body. And I knew that he worked inside a lot and he didn't spend a lot of time outside in the sun, and that's, by the way, the best place to get vitamin D. But everybody's concerned about skin cancer, so they put sunblock on, which blocks the absorption of vitamin D. So I sent this patient for a blood test. Now, normal range on your lab test are 30 to 100. He was 18. He was so below normal. Plus, he was below optimal because optimal is 50 to 70. Once I put him on some vitamin D3, within 3 days, all the other sundry joint pains and achiness and stiffness and his mood and his energy levels all increased significantly. So if you're deficient in vitamin D, that could be the cause for your lower back pain as well as other musculoskeletal problems. So you want to check your vitamin D level. The third thing on the list, number three, is adrenal fatigue. What is adrenal fatigue? Well, adrenal fatigue basically relates to a little gland, triangular shape, that sits on top of your kidneys. Your adrenal gland is part of your fight or flight mechanism, your stress response. And I'm sure that you're under stress because a lot of people are under stress. It's really unusual for not to have someone come into this office that doesn't have stress. And that stress impacts the adrenal glands over a while. They can only respond to that stress for so long before they go into fatigue. And what happens is when your adrenals aren't working right, cortisol levels drop. And cortisol is important in inflammation in the body. Also, because your adrenals sit on top of the kidneys, they regulate very important things like sodium and potassium and magnesium, as I mentioned earlier. And they determine how the body keeps it in or allows it to be expressed out. And if you're deficient in some of those important and trace minerals, it's a good possibility your muscles may not be able to function properly, and that could be a leading cause of back and neck pain. So you want to check how your adrenals are functioning. And I see that so often in the office with adrenal deficiency, making people fatigued, craving salty foods, waking up in the middle of the night, having that slump in the afternoon at 2 o'clock in the afternoon. And it is so easy to remedy with a specific supplement that we use to help boost the adrenal glands and get them back functioning again. So these three things, magnesium deficiency, vitamin D, adrenal fatigue, are three key things your doctor probably never even talked to you about as possibilities for causing chronic back pain. And that's something we look at, or at least I look at in the office here with my patients on a regular basis. So if you're having chronic back pain and you haven't addressed these things, you might want to give me a call. I'll be more than happy to take a look at it. We can give us a call at 732-356-1155. Also, go to my other YouTube website and take a look at some of the videos we have there. You'll find they're very educational. This is Dr. Wolk-Weiss, your Central New Jersey chiropractor, saying stay healthy.